The fear of vomiting, where did that come from?
It really came from just traumatic vomiting experiences.
You attempted suicide. Those are all big deals. Well, thank you so much for doing this.
Well,
today.
Thanks for looking at my brain. I'm excited to see what's going on in there. My boyfriend is a huge fan of you, already has been, but then I got to hear you speak and become a fan as well. And then we listened to some podcasts as well and have definitely been cutting out alcohol and caffeine since we heard you.
Yeah, and after today, you're going to love your brain even more.
Yeah, that's cool.
Tell me about your company.
Weighted blankets.
You do weighted
stuffed animals.
And
then they're heatable or coolable.
And where did you come up with that idea?
I really liked weighted blankets when I was having panic attacks. And so I wanted to make something portable and cuter. And then also I just hoped it would kind of even destigmatize conversations with people where they come over and maybe they see them on your couch and they're like, oh, what's that? And then maybe you find out they struggle too. And it kind of opens up those conversations.
How's business?
Really good. It's actually kind of crazy how many people in so many different walks of life have needed that comfort. At first I just thought anxiety because obviously that's my biggest struggle. But now, people with autism, people with a recent loss, people with sleep struggles, so many different things it's been able to help with, which is really cool.
That's awesome. And did you start the company first or did you do YouTube and become an influencer first?
YouTube and influencing first. I kind of fell into it when I was in college and was really happy because I hated college. And then I just knew that I really wanted to do something in the mental health space. And that's what my calling was. So I was hoping that it would lead to that one day. And luckily it has. But yeah, it's definitely my biggest passion is that space.
It's awesome. You're turning your own pain into purpose.
Yeah, exactly. Because if there's no purpose from it, then what did I go through all that for?
Yeah. Pain shared is pain divided.
Yeah.
So I took notes. I read your history. I looked at your testing. I've seen your scan. So I have sort of a good idea of what's going on. And things can be better.
Yeah, definitely.
Okay. And your goal, I wrote it down, was to learn more about your brain.
Yeah.
And how many psychiatrists have you seen?
Probably 4. Yeah.
What was the best experience?
The best experience was actually an emetophobia specialist. So she was really just treating the emetophobia and the panic attacks.
So with the fear of vomiting, talk about where did that come from?
It really came from just traumatic vomiting experiences. I've probably had 3 now. One time I just woke up at 2 a.m. just completely covered in vomit and diarrhea, projectile vomited for 2 days straight uncontrollably. A few years later,
What was that from?
I think it was from food poisoning it was probably the stomach flu. Because if it lasted that long, it was probably a flu. We weren't sure. I didn't go to the hospital or doctor or anything. We just kind of wrote it out. My mom made me drink water and eat saltine crackers.
And you were how old?
12? Yeah, I think it was 12 when that happened. That really freaks me out about vomiting. I was just I don't like it. I've never liked any form of loss of control. And to me, that's one of the biggest losses of control is you can't stop yourself from vomiting.
Tell me about this suicide attempt.
School was not fun. Bakersfield is a very special place. Every time I say that, I get comments that are yeah. The bowling was really bad. Whether it was a guy hitting me in the head with a baseball having food thrown at me, having my house vandalized.
Well, why did you get bullied?
I started doing some acting and ending up in like the news. It was a very small town. And then I went on a date with one guy, and this girl made it her mission to just ruin my life after that. I didn't even like him, didn't go on a second date. I feel like it was just a fixation, and I was a good target because I was really emotional. I cried a lot, but basically all the trauma built up. And I felt really hopeless. I was really depressed. I was self-harming. I was cutting constantly. I didn't have siblings or anyone I could really talk to about it. And thankfully, this generation's a lot better about communicating. But I mean, in my generation, which wasn't even that far back, you know, if you told someone you're having these feelings, it's almost like they thought they were contagious. And they were like, don't talk about that. I'm going to stay away from you. Like, why would you want to kill yourself? Fast forwarding to like right before it happened, I lost my virginity to being raped. The bullying continued to get worse. I didn't see a way out. I had to like face the guy that assaulted me every single day at school. And so one day I just like left a voicemail on someone's phone and then like took a knife to my hip and just like started bleeding out.
Well, I'm so glad you were ineffective.
Yeah.
At doing that.
Yeah. Luckily I didn't fully know what I was doing, but yeah.
Yeah, because it's a crapshoot. I mean, sometimes you could have, and then all
It
the people
crazy,
you're
though.
helping, where would they be?
I mean, it's crazy. I mean, a lot of people I've heard this from that have not completed the suicide attempt and something's happened to save them, thankfully, is that like in that moment, I kind of realized that I do want to live and I made a mistake. And I mean, since then, I only self-harmed once since then. I got clean and I actually started really valuing my life and changing things and trying to live and trying to have a future and trying to picture things. And it got a lot better. So I guess the silver lining in that was finally finding the like strength to try to live.
Has anybody looked at your brain before today?
No.
That's insane. Right? I mean, your anxiety, your behavior, you attempted suicide. Those are all big deals. And no one's looking at your brain. They're just looking at you, talking to you, and go, oh, you have this, let's do that.
Yeah.
That's what I'm trying to change. I think that's nuts. And I'm a psychiatrist, so I know how to diagnose insanity. That's nuts. They should have looked at your brain when you were younger.
Yeah.
But we did now, and you're still, at least compared to me, very good. So SPECT is a nuclear medicine study that looks at blood flow and activity. It looks at energy in the brain. And it basically shows us three things: good activity, too little, or too much. And then my job is to balance it. Look at your scan.
Ooh,
it's older than you are. It's bumpy. And you don't drink. You're not doing drugs. So it's like, why?
Never done a drug.
Me neither. Congratulations. My generation was loaded.
Yeah.
They were pioneers in drug use. And I always went, well, that's just stupid.
What are those?
Never wanted to lose control. I think it's a combination of the cord wrapped around your neck when you were a baby and the multiple concussions that you had. And that's what's given you sort of the reading problems, the focus problems.
Oh, cool. Wow, I never stood a chance. I came out of the womb messed up. That's not fair.
But you've done awesome. So,
Whoa.
see, here is your right temporal lobe. You can sort of see a shelf here.
Yeah.
It's right here. It's an area of the brain where the amygdala is.
What's that?
And it's the fear center. in the brain. And you sort of whacked it. If you do what I ask you to do, and I scanned you again like 4 months later, it can just mostly be normal, healthy. So there is nothing that we can't fix. So I don't want you to leave and go, I have holes in my brain.
Yeah.
What the holes mean is low blood flow that can be repaired.
Improve.
Right.
Okay.
So I want you to leave going, okay, Dr. Ehman understands why I have trouble. I'm not imagining it, but if I work hard, I can be better.
So is that kind of where some of the anxiety and stuff comes in? Is that fear?
So sometimes when there's trouble here, it'll cause anxiety. But I think the anxiety is coming from here.
What's that?
We look at your brain, your cerebellum is sort of quiet, but your basal ganglia is part of the brain that's involved in anxiety. Way too active. So calm the anxiety, stimulate the cerebellum.
Okay.
Questions?
I don't think so.
So I think you're awesome.
Thanks.
And you've survived a lot and you're creating meaning and a dent in the universe. So, and your brain can be better. You can get better blood flow to your brain. Are you claustrophobic?
Not really anymore. It like bugs me, but I'm okay.
Because have you ever heard of hyperbaric oxygen therapy?
Yeah.
I think you should do it. I think it'll help your brain. I make something called theanine gummies when you feel anxious. So if I want to calm this down, that could help. And then to help your brain, I'll put together a shake that has Bright Minds powder, multiple vitamin with a brain boost, and that can help your ADD symptoms.
Okay.
And then put vitamin C and omega-3 fatty acids, both of them anti-inflammatory, both of them can boost your mood.
Okay, cool.